we're going to put a little bit of gel in here because remember, the ultrasound uses sound waves. It needs a medium to go through. And at the doctor's here, we have cold gel. Sorry. Usually it should be nice and warmed up. Some doctors will still do cold because they don't want to burn the patient either. So we'll start with 2D because that's what's pretty routine. 4D is really exciting for parents to look at, and it can highlight some special abnormalities, but really a 2D right now is what's considered standard of care. And what she's doing is she's looking to find the position of the baby. Usually we start by sort of finding where the head is and getting head measurements. And basically, there's 2 measurements that we get. You get for the head measurements, and this all goes to be calculated into the overall weight of the baby, which is important because there's certain milestone weights the baby needs to be at. That way, we know if it's thriving or not, if we should do more surveillance of baby. Then we look at the heart, look at the chambers, look for any abnormalities. You can see it beating beautifully there. You can see all 4 chambers, which is great. And again, this is 2D. We're going to show you the difference in just a little while. And you can also get the abdominal circumference as she moves down, and that's kind of the sequence that we go down. You can see the spine, you can see the stomach bubble, you can see the umbilical cord insertion, and then we get measurements at that level. Then we go down even further, and we get what we call the femur length or the thigh bone length. And we'll also look at the fluid and the placenta and the umbilical cord insertion. And those are all wonderful things. Now, what everybody wants to see and what you want to see, which is great new technology, or at least the latest technology, is the 4D ultrasound. And one of the easiest things for you to correlate it with it is if you look around the face and see, we're going to see a profile first in 2D, so you can see the difference. And you have just a gorgeous baby profile. I can't say Dad if she looks more like
she gets it
you
from her dad.
or okay, Dad. This is a great way for dads to get involved in the exams too, because they feel sort of away from everything, to see their baby and feel connected. And so that's the 2D. Now we're going to switch over. So let me just show you. Go back to the 2D. I'm going to show you the profile for you at home. So the head and then the nose. You can see this is the profile of the face right here. Now we're going to switch to 4D, and you'll be able to see the difference because it's really quite remarkable.
Here she is.
In just a second, we'll see the magic of 4D. So this is the 4D on this side. This is the 2D, okay? And you can start to see the outline of the baby's face right here. Aww. It's beautiful profile, absolutely gorgeous. Baby. Nose, eyes, forehead right here, absolutely gorgeous. So for parents, most parents want to get the 4D, and that's fabulous because it really, if it helps you connect to baby, because it's such a new, thing, then that's really great. Again, as far as what it can delineate any differently from 2D is not that much, but it's really great pictures. And here you can see the eyelid. So this is the eyelid here. This is the face. You have to look at it because you have to get from the 2D to the 4D, which is a depth perception. Once you start to look at that, you can really see the whole sort of physical cast of the baby's face. And it's just right in here, and it's really wonderful. It's going to pop out in just a minute. You'll be able to see it again.
There she is.
Jake and Sarah, what do you think?
She's gorgeous. She looks just like me. What can I say?
See again, eye, forehead, nose. You just really have to look at. We're used to looking at this, so it's a little bit easier. But this is the outline of the face. And again, it's so key just for the health of the baby and the health of mom for delivery to get this 20-week ultrasound, whether it's in 2D or 4D. It needs to be done.